This is group 13, pulmonary disease. My name is Malik Rogers. The definition of pulmonary disease, a type of disease that affects the lungs and other parts of the respiratory system. The pulmonary disease may be caused by infection, smoking tobacco, and other air pollutants like asbestos and stuff like that. Pulmonary disease includes asthma, chronic obstructive pulmonary disease, which is COPD for short, pulmonary fibrosis, pneumonia, and lung cancer. The anatomy of pulmonary disease. Pulmonary disease is mainly affected in the lungs. The lungs are located on both sides of the thorax cavity. The trachea conducts inhaled air into the lungs through the tubular branches. Anatomy continued. The lungs are covered by a thin layer called the pleura. This also lines the chest cavity. A thin layer of fluid acts as a lubricant, allowing the lungs to slip smoothly. For our patient's medical record, we would be looking for personal identification information, medical history, if they ever been to the hospital, had immunizations, anything like that, family medical history, medication history, treatment history, and medical directives. What you should look for in screening. Basically, screening means testing for diseases and any conditions that may not be causing symptoms yet. So we would screen and we would look for stuff like high blood pressure, high cholesterol, high resting heart rate, shortness of breath, and wheezing. Also, dizziness. Okay, the scenario is for our group is a 40-year-old man walks into the doctor's office complaining about chest pains. When breathing and shortness of breath, when breathing and has a shortness of breath. Symptoms began a couple days before and worsened with no causes. He had a similar symptom 1 year ago with acute chronic obstructive pulmonary disease, which is COPD. He uses a BiPAP support at night for shortness of breath, and he denies having any fever, chills, wheezing, or coughing. See, wheezing is one of the things that you would look for in a screening. So that's one of the things we would look for. Okay. He does have difficulty breathing at night, forgetfulness, mild fatigue, feeling chilled, requiring blankets all the time, increased urinary frequency, and swelling in the lower body. He barely gets out of bed 7 days except to use the bathroom. His family history includes heart disease, prostate disease in his father. He used to smoke for 15 years but quit a couple years ago due to shortness of breath. Does not smoke or drink illegally. Also, no known food or drug allergies. Medical history is significant coronary artery disease, hypertension, COPD, and vascular disease. And he takes multiple medications. Signs and symptoms when he's exercising. These are the symptoms that we want to look for when he's exercising. Look for if he has a fever, if he feels nauseated, has abnormal chest pains, because you get a little chest pain when you're working out, but abnormal chest pain. He's out of oxygen, basically out of breath. Unexplainable leg pain that can speak to like clots in his legs and stuff. And use the Borg skill to express his pain. So yeah. The exercise program that we're gonna have him on is walking, jogging, swimming, resistance training with hand weights or a band, and skating. We make sure that our client warms up and stretches before every exercise and cool downs after. This will reduce stress on his heart, muscles, and joints. Our workout is up to 30 minutes and it's 4 times a week. Accommodations and recommendations. Okay, When our client is not feeling 100%, swimming will not be done that day. Also, skating will be held off until the client is feeling well so that he is not overwhelmed by any of the workouts. We advise our client to keep his heart rate at 50 to 80%. This is normally difficult with people who have COPD, but it was our goal, and we wanted the client to know for himself what the goal was. On the day off, our client has the option to rest for 20 minutes in between workouts. On a day off, our client has the option to rest for 20 minutes in between workouts while staying hydrated the whole time. He should not base his condition on whether or not he can complete certain exercises. Okay, so now here's a little YouTube video that explains the workout that we would be doing. It's kind of long, so I'm gonna skip ahead. Basically, he's just doing flexibility exercises, simple exercises to keep him active. Other stretching exercises, leaning to the right, to the left. You know, time check for me. What's the time check?
6:30.
Okay. So basically, I'm gonna leave this link at the end, under the when I turn it in, there's gonna be a link to this video. So if you wanna watch the rest, you can. But thank you.